The Kenya Union of Post-Primary Education Teachers, KUPPET, has once again raised alarm of what it describes as inefficiency over the Social Health Authority SHA system for its members in various parts of the country. Teachers say they're being turned away from health facilities despite assurances from the Health Ministry that challenges within the scheme will be resolved. This comes even as the Health Cabinet Secretary Inion Duale defends the system, revealing that several health facilities have been shut down over fraud concerns, even in regions where these teachers are still struggling to access healthcare. Victor Ngaruya has the details.
The Social Health Authority once again finds itself at the center of controversy, with teachers across multiple counties reporting growing difficulties in accessing medical services. Members of the Kenya Union of Post-Primary Education Teachers, KUPPET, say they are being denied medical attention, with hospitals either rejecting the SHA cover or demanding upfront payments, raising more concerns over the functionality of the system.
It appears the Social Health Authority facility is not working because either the hospitals are blackmailing our members because there is a lot of outcry in the Western region, Eastern region, and even Northern Kenya.
The union now warns that the situation could escalate into an industrial action by the end of April 2026, with teachers growing increasingly frustrated over what they describe as unmet promises and systematic inefficiencies. At the heart of the dispute is the transition from the previous Minute Medical Scheme to SHA in December 2025, a move that placed over 400,000 teachers under the new National Health Framework. But for many, the shift has come at a cost. Teachers say the previous medical cover, despite its ups and downs, offered more comprehensive and predictable benefits, unlike the current SHA system.
I'm appealing to the government to review the SHA issue so that teachers can get comprehensive medical covers.
When we were having Minute, the cover was providing last expense. We were getting last expense to send over our teachers who have passed on. But in this arrangement for SHA, we don't have last expense cover. There is nothing. There is nobody organizing when our teacher has passed on. Nobody bothers how the teacher will be buried. So as bad as Minute was, you can see they were able to send over a teacher in style.
For others, the frustration is immediate and practical, arriving at hospitals only to be turned away.
We need to go in the hospital you attended to. Maybe we could have some delays. But nowadays, SHA, many hospitals are not accepting SHA because they are not remitting the money to the hospitals. So you can go in the hospital, they tell you we are not accepting SHA. So you are stranded and frustrated.
These challenges persist even after KUPPET met the Health Cabinet Secretary Inion Duale and SHA CEO Mercy Mwangangi on the 13th of March this year to discuss the matters.
They did indicate to us that the teachers' issues related to the managed scheme of SHA will be addressed. So far, nothing is doing, especially in the region of Western, where many of our members are being sent away.
Health Cabinet Secretary Inion Duale says at least a dozen fraudulent public and private health facilities have been shut down, with many more under investigations of alleged SHA fraud, especially in regions KUPPET Secretary General says members are being sent away. At the same time, Duale insists that SHA is working, promising that reported technical and administrative challenges in hospitals will be addressed.
We will protect public resources meant for the treatment and the health care of our citizens, be they ordinary citizens, be they civil servants, be they police and Kenya prison officers, or be they our teachers.
Even as the government defends the integrity of SHA, the growing outcry from teachers underscores a widening gap between policy and the reality on the ground. Victor Ngaruya, NTV.